Good afternoon and welcome to meeting Doro Pasantes. I'm very pleased to be talking to you, Doro, because we've obviously spoken quite a bit because Doro is one of, is it around 60, just under 60 of the national therapy centres across the UK, the multiple sclerosis national therapy centres?
That's correct, Katrina. I think, well, there are about 50 centres across the whole UK. And I am Chief Executive of the Brightwell, which is based in Bristol. And we cover quite a large area. Well, from Taunton, the whole of the Greater Bristol area, North Somerset. People come to us from Wales as well, from Bridge in Wales, all the way to Bath.
So the therapy set, well, I suppose it's two concepts really, isn't it? Because you come under the umbrella of the charity called MSNTC, which obviously the MS, as I said, stands for multiple sclerosis, but you obviously cater for a lot more conditions, whether they be conditions or a symptom, whether it be some form of injury. That's right, isn't it?
Yeah, that's correct. So MSNTC is an organisation that guides us and helps us in all things oxygen therapy as well. But centres were set up the Brightwell was set up in 1985 to help people primarily with multiple sclerosis. However, what we found was that the therapies that we offered, and most centres have found the same, were actually of benefit to other people and other people where there weren't very many treatments available for them through the NHS, including the long-term neurological conditions. So like chronic fatigue syndrome or fibromyalgia or stroke, Parkinson's, all of these conditions benefit from the treatments and therapies that we offer at the centre. And that's how it came about, really.
I went to visit the one in Guildford, and I'm just now can't remember for the life of me the name of it. What's the one in Guildford called?
Sampson Centre.
Sampson. I wanted to say Saxon, but I knew that was wrong. And I was first of all, when I walked in, I just felt it had such a nice, bright, comforting feeling, I think was what I felt. And that was from the positivity that I felt from the staff that were there, or the therapists that were there, but also the fact that people that were in the centre, because not only were there the physios and the healthcare professionals, but a lot of the centres are very much run and coordinated by volunteers who have these conditions as well, don't they?
That's absolutely right. And I think, across all centres, that tends to be the mix. So we have the healthcare professionals that work there, as you said, physios, nurses as well in some centres. And then we have different therapists, but we also have our members. And for example, at the Brightwell, the oxygen therapy is wholly run by volunteers. So they actually are our chamber operators. We have about 15 to 20 volunteers that regularly run all of our sessions.
Wow.
And the board of trustees is made up from a lot of the members also. So it is a member-led centre, the Brightwell, and many work in exactly the same way.
And yes, and I think that's the important thing to say, is that each one of the centres are their own individual charities as well. I mean, I just think the work that you all do is fabulous. So before we move on, because obviously we're going to concentrate on the oxygen therapy, which I suppose, is that the thing that you would say that the centres are most renowned for, or is it just because collectively you've got the most chambers in the UK? I've no idea.
I think it's probably both. Well, actually, perchance not the first, because I don't think many people know that we have these chambers and that we're, we're here. So I think that's one of our...
Do all of them have chambers?
I would say probably not all of them, but the majority. So the majority of MS therapy centres have oxygen chambers. And it's my understanding that that's how it all came about, how MS therapy centres came about in the first place. It was about oxygen therapy, trying to deliver some sort of therapy to people living with with MS, with multiple sclerosis. So as you say, we all have, it is our unique selling point, even though we don't sell, we ask for a donation in the main from the members, from the people who use our centres. We do guide them in that sense, even though some centres, the Brightwell definitely has a trading arm set up as well, where we encourage others to come in for oxygen for things like sports injuries and muscle injury, things like that. And those people, we do charge for the therapy, and all of that goes back into the charity. So it goes back to help provide therapies for those with neurological conditions.
Yeah, and I think what I sort of think is really fascinating is the fact that, physiotherapy is expensive because it's never just a one-off job. It's a continual thing. And if you've got a chronic condition, it's very expensive. And that's what I felt was very encompassing about the MSNTC centres. It's, you're not defined as whether you can afford to come. You can come, and then let's look at what we can do to support and help you.
That's exactly right. And, I often say when I have people in the centre and we're showing them around, and I'm sure that we are so similar to other centres in this, that many of our members have been coming for 32 years. We've been open 32 years, and many have been coming for that period of time, and many for many, many years. So the therapy in long-term conditions is ongoing. It's not about curing an illness that's incurable. It is about management and symptom management. And for many people, they need ongoing treatments and support. And that is generally on a weekly basis, maybe sometimes a little bit less, or sometimes a little bit more as well. Some people, if they're going through a crisis or moments of crisis, they might be coming to the centre every day or every other day for a period of time. So it's about supporting the individual through whatever they're going through at that time.
And that support is multifaceted, isn't it? Because it's building a relationship with other people as well, with your healthcare professional, and with people that are also at the centre who also have similar. And we all know that if you can share or speak to somebody who has something similar to you, it's really helpful, isn't it?
And it makes the biggest difference to have a healthcare professional or a person who sees you week in, week out, and appreciates, where you are and whether there's deterioration or whether there's improvement, and can then follow up with your GP, another healthcare professional involved in your care. That's what's really important about MS therapy centres, that there is that follow-up and that support to a member through many years. So probably no one knows our members better than the therapists who see them week in, week out.
And actually, that's really, I hadn't crossed my mind, but that is really important. So we all know how, we have good days and bad days, and we're not always the right person to judge ourselves whether it's bad or good.
And that happens a lot with the oxygen therapy as well. So in the past, if you imagine someone's been having a treatment for years, in fact, in the cases of many of our members, for years, and sometimes I think, well, is this doing anything for me? I don't think the oxygen is helping me anymore. I can't, I don't feel any different. I'm deteriorating slightly, but I don't feel that there's any benefit at the moment. So we sit down and say the best thing to do is take a week off, take a week or two off, and then have a look and see how you feel after that. And 9 out of 10 times, if not 10 out of 10 times, most people come back and say, oh my goodness, the difference that I've noticed that made from not having it to actually then coming back and having the oxygen therapy, or anything else for that matter. Physio, if you're having regular exercise, we all know the difference that can make to you as an individual. And because it's guided, and you're coming in and you're doing it, and and the physio can address any of the issues there and then it makes a huge difference.
But I think that goes with any form of, self-care management, is adherence. It's so important. So often we say to people, they feel they've got better, so they stop taking their medication, whether it be popping a pill or putting cream on, and then a month or 2 months later, it's back again.
Absolutely. And what we find is what's the main cause of not carrying on? It's having encouragement. That's what people need, and that's why they come to the centre, because our therapists, other members, you know, everyone encourages you to carry on and actually just to look after yourself and actually do all the things that we know we have to do. It's like bits of the puzzle, isn't it? If you better and you look after yourself and you exercise and you do different things, you get to much better outcomes.
And it's a tough gig doing it on your own, especially if, you know, you've got everything that you try to do is physically hard work. It's so much easier just to sit on the couch, isn't it, than actually try and get up and do something. So to have that regular contact is really important.
It is, and it is for the best, you know, the most of us, isn't it, when we're thinking, oh, do I have to get up and do that? So if you imagine that on top of that you are fatigued or you're in pain, or, you know, it just is another level, isn't it, of not want of impediments in the way of you actually getting up and doing what you need to do.
So before we go into talking about oxygen therapy, which I'm really fascinated to know about, and also the effect on long COVID, because I know that, you know, you're going to be start looking at that as well. Let's just tell me a little bit about your background. I mean, is this your background, or?
Well, it is my background for the last 10 years, actually a bit more than that. I think it's 11 now. So I came to the centre as a volunteer initially. And it's funny because I assume that many centres probably have the same experiences. And my experience wasn't in healthcare at all. If anything, it was in business. Well, Spanish Chamber of Commerce I used to work for in London. But I don't think it matters where you come from. It's getting to know the centres, what they do, how they deliver it. And it was fascinating and it was brilliant. And getting to know the people who use the centres as well, and just how happy and switched on they are, and wanting to live and catch a life, and that just made a huge difference. I thought, I don't want to work anywhere else.
Oh, yeah. I think that's the thing, is that we all take our health for granted, and when something doesn't work, it's like, what's going on? And, you know, we should, you know, you're very lucky if you don't have health issues, especially as you get older.
Absolutely. And I think, you know, many of us do end up developing different issues. And I just know that the centre is there and will be there to support in any way that they can. You know, that's what we do. That's what we're there for. So
let's talk about oxygen chambers. And I remember when I first started talking to MSNTC, I just kept talking about oxygen therapy, and then people started saying oxygen chambers, and that's why I went along to understand, because of course I had it in my head that you just went like that with a mask, but you do go like that with a mask, but it's not quite. You explain what it is and how it all works.
So, oxygen therapy takes place in a chamber. So it's a metal chamber. There are different shapes and sizes. Well, when I say different shapes, there aren't that many different shapes. There are either circular chambers where you're sitting in a circle on the inside, or there are cylindrical chambers. So you've 2 rows facing each other. And some of these chambers can be smaller, so they can be mono chambers where only one person goes into them, or they can be multiple use chambers, so there's more than one person in them at a time. At Bristol, at the Bristol Centre, at the Brightwell, we have an 8-person chamber, so it's a circular chamber. We only ever seat 7 people in there because of there would be one person behind the door, and it's a very heavy door, and if that banged into your knees, it wouldn't be very nice. So we don't have anyone behind the door. And absolutely, you go into the chamber, you connect, so you're wearing a mask, and you connect to the oxygen, and you connect to the outlet pipe, which is where you breathe out. So all of that gets taken away, and you might be sharing the chamber with more people, hopefully 7 in total with you. But at the moment, because of COVID, we have reduced numbers in there. So at the moment, it's only 5 people in there, so that there's enough space in between. And then you breathe oxygen under pressure for an hour. So we get you to pressure, while you're still on oxygen. That whole time you're breathing oxygen, and it's 100 or as close to 100% pure oxygen as it can be. And then we depressurize the chamber, and then you come out, and hopefully you'll feel the benefit of the session you've just had.
So when you're sitting there with your oxygen coming, when I've had oxygen, for example, in a hospital, you have an operation, for me, it just felt like that some air was being blown at it. Is that the same sensation?
Yeah, so that you don't have tubes going up your nose, so you're in a mask. It should feel no different to normal breathing, except for you are wearing a mask, and it should be really nice and tight. So we say, if you want to know whether you've done it correctly, when you come out of that chamber after an hour, you want a nice red mark around your nose and mouth, just to show that you've been wearing that mask correctly. And it should be, you're just breathing, what we try and say is breathe normally. Now, normally when you're in there, especially at the beginning, most people do have a slightly deeper breathing because you're wearing a mask and you want to get as much in as you can, and that's fine. But good breathing is important as well. So we don't recommend that people fall asleep in the chamber, because your breathing becomes much more shallow. So just a good steady breath, and you are having to work through some valves, but as the pressure increases, that becomes easier as well. So the breathing itself, because you're pushing open a valve and you're pulling from another one. But there should be really no difference to what you and I are doing right now, except for you can't talk.
I was just going to say, there's no chatting going on. So, and you can't feel any difference with the air at all in your body?
I don't think so. I think sometimes people feel that their chest has worked a bit harder, maybe. But beyond that, there should really be no difference. It's normal breathing, but through a mask.
And then how long do you sit there?
So we do say, so you're sitting down. However, there's nothing to stop you. If you need a bit of a stretch, you're connected to 2 tubes, and there is a bit of give in them. So if you needed a bit of a stretch, we wouldn't stop people standing and maybe having a bit of a stretch, because we know it can be uncomfortable. So the whole, from beginning to end, is about an hour 10 or an hour and 15 minutes, depending on what pressure we go to.
Right.
The higher the pressure, the longer it takes to get there. And we pressurize at about two little atmospheres every minute. So sorry, I can't remember what they're called, but to get to an atmosphere. So normally it's about 2 feet a minute, that's it. So our lowest pressure, which is P2, which is the equivalent of 16 feet, should take about 8 minutes to get to. P3 should take 12, and P4, which is the equivalent of 33 feet, which is the maximum that any centre can go to, which is 2 atmospheres.
Right.
So 1 atmosphere over atmospheric pressure, that should take about 16, 17 minutes.
I've just completely forgotten what I was going to say, but do you ever get, are these the same that either pilots would use or deep sea divers, or is that something totally different?
No, it's not. So the chambers themselves and what you see, the equipment that you see, is not dissimilar from what you would see in a hyperbaric oxygen chamber. But we do not deliver hyperbaric oxygen, and that's really important to highlight. There are hyperbaric oxygen units all around the country, and in the main, they treat things like the bends and decompression. Well, decompression sickness is the bends, but some other NICE approved illnesses and conditions. However, they are highly regulated, and there are really strict guidelines for them. They go over the 2 atmospheres. And in order to access those, there's a whole series of tests that you need to go through first. And they have very strict procedures on what you can wear and can't wear. And there will be medics on hand, nurses and medics on hand through every stage of the process. We have our own standards as laid out by MSNTC and our Code of Construction. And we follow their published guidelines as well, and through an operator's manual. And they provide training for our operators, who are highly trained, and it's regular training as well. And we operate as registered charities, all of us do. And we don't exceed, that's the really important thing, we don't exceed 2 atmospheres of pressure.
And is everybody, when you're all sitting around, are you all going at the same level? It's all at the same level?
So the chamber, air is added to the pressure, air is added to the chamber, which decides what pressure we go to. So everyone in that chamber would be at the same pressure.
Right. And is it the chamber that's pressurized and you have ordinary oxygen coming in?
That's right.
Yeah. Right, okay.
Pressurize the chamber with oxygen. The chamber is filled with air, and you are breathing oxygen on demand through a mask. So you're connected to a tube, there's a little valve in there, and every time you breathe in, that valve opens and delivers the oxygen. And as you breathe out, there's another tube, so that the valve is closed then, another tube that the valve opens in there, and it takes the oxygen, what you're breathing out away, and that gets taken out into the ether outside of the building. So you're never rebreathing what you've breathed out, and you're getting new oxygen in. So in terms of, you know, what's oxygen therapy, so David Downey, who's the technical advisor for National MS Therapy Centres, explained it really well to me once, and I thought, oh no, I get it now. So in the air that we breathe, under normal atmospheric pressure, so out there, and there's 21% oxygen in there, and this oxygen passes through our lung walls into the blood, into the hemoglobin in the blood, and as it travels through the body, it dissolves into the plasma under just normal atmospheric pressure, and the plasma is the liquid that carries the hemoglobin, so it carries the blood cells, and as it travels through the body, the body cells take in that oxygen and convert it into energy. Atmospheric pressure affects how much oxygen is dissolved in the plasma. So, for example, if you go up into somewhere that's very up at altitude, the pressure drops, and so there's less oxygen and it's harder to breathe. So the principle of oxygen, as it was explained to me, is really simple. It's based on normal gas laws. And it's, if a gas is pressurized over a liquid, then it will dissolve into that liquid. So the analogy he used, which I thought, now I really get it, is he likened it to a fizzy drinks bottle.
Right.
So when you look at a fizzy drinks bottle, in the bottle unopened, the liquid looks flat. It's in there, but we know that it's full of gas, because the minute you open the bottle up, all the bubbles come up and it starts to fizz, and you can physically see it. And so that works similarly to when a person goes into the chamber. So when a person goes into the chamber, and then we add the pressure, more oxygen is dissolved into the plasma and goes around the body and gets deposited into the cells, and they create energy. And so the higher the pressure, the higher the oxygen levels that your body is taking in. And then, like the fizz in a bottle, when you come out of the chamber and you've stopped breathing the oxygen, the excess will leave the body over a period of time, like it does in a gas bottle, and through your lungs and through your normal breathing.
Right. But I suppose the key word here is the word energy, isn't it?
Absolutely.
That's the real key thing. So, I mean, I'm keen for us to move on to what the benefits are and who benefits from it. But the other thing I was just going to say is that I do know that you go to, so presumably, can anybody have this treatment, or is there certain sort of health restrictions, or people, I don't know, with people with CPD, yeah.
COPD, I know exactly what you mean. Okay, so the way it works with centres, or definitely with the Brightwell, this is what we do. So we are open to anyone who feels it's a self-help treatment. So like you would go for acupuncture, or like you might go for another for physio treatment to support, it works in the same way. But when they come to us, we do, with the oxygen, but with all therapies, we have a pack where people fill in some information. And then we also have a letter that we want them to take along to their GPs that says that they're interested in having a number of therapies, including oxygen at the centre. And is there any reason that they feel, or any reason that they think they would like to talk to us about? And we do have an oxygen advisor on hand through HVOTT, and Professor Philip James also is the Nationals. He's their honorary medical advisor. And so through them we have if we had an issue, we had a question, we thought, why can't this person, can this person do oxygen? We just ask straight away, and they will let us know. I know that there are some drug treatments that you shouldn't have oxygen with, so some cancer treatments, and not because they would do any, I think it's more because medication is measured out so specifically that it may potentiate the effects of that medication, will change them, so it may make that effect stronger. So I know that we would recommend that people didn't have oxygen therapy under those circumstances. But really, it's open to anyone who feels that they would benefit. Okay,
and presumably, so that's good, is that really you make sure that the GP knows you're going to be doing this. And do GPs generally, because I suppose this could be slightly controversial, because we know it's not available on the NHS. So how does that work with GPs understanding about it? And why isn't it available? Or is that what we're trying to make it available?
That's a really good question. Why isn't it? I don't have the answer to that. In the main, our experience is that most GPs are really open to it. I think what they see is that this is a place where people can go and get help. Oxygen therapy will not cause any great harm to anyone that comes and does it. So that it's about people taking back control. Obviously, if they have any issues or questions, they're the first to sort of come back to us, and we pass them on to our advisors and to talk through it with them. But in the main, we've, very, very rarely has a GP said, no, oxygen isn't for you. And then it's a case of talking through the scenario and trying to see whether that is the case for that particular individual. You mentioned COPD. It's a tricky. We have treated people with COPD in the chamber, and again, I think it comes down to we don't go to huge pressures. It's 2 atmospheres maximum. I think, if I'm not mistaken, for someone with COPD, we would stick to the lower pressures anyway. So, you're giving someone oxygen, and surely for all those conditions as well, we've been told by them that there's a benefit. So they feel
and what I should have done is start off, before I got into the nitty-gritty detail of the experience of going to sit in one, I should have actually started off with what the benefits, why on earth. So we've talked about it, but we haven't said why one would go. What are the benefits? And I think we have to say that most of these are sort of anecdotal, really. And of course, and I know that all the centre managers and everybody that uses it, but there's loads of anecdotal evidence about how positive people have found it. So, so what are the main reasons that people go, benefits they find?
So in a condition like multiple sclerosis or another neurological condition, most people find that other than having to give up that hour and a half of your time, and it's regular, that there's a benefit in many of the symptoms that they experience. So they feed back to us. So we do initially, when someone starts going through their block sessions, we have a document that they fill in. So we go through an assessment and work out where their main areas of where their main symptoms are, and ask them to score them on a level of 1 to 10. So fatigue, for example, could be quite high. That would be a 10, etc. So all the way down. And after every 5 sessions in that block session period, we then ask them to do the same thing again, to see whether there's been an improvement, whether people are the same, with sort of the level of change that they experience. So we have that, and I think most centres have that across, across the board. And in people with neurological conditions, the main symptoms, in my experience, that they feed back and tell you that there's a benefit in is fatigue. They feedback that they sleep better, that it helps to manage their pain. So things like fibromyalgia, pain management is really important, and after they've had oxygen, and also the brain fog. So a lot of neurological conditions, people find that they're not thinking clearly, they can't find the right word, they can't find, there's just this, that's how it's described, a brain fog that stops them from doing all the things that they would normally do. People end up having to write lists or be really meticulous in, remind themselves with timetables and diaries, and because the memory just isn't there. And in many people's experience, after oxygen, we've had feedback that says that maybe not the same day, but for a few days after, that sort of clears. So the brain fog clears, and that's when they do things like their accounts, if they're, they have their own business, or that's when they do the stuff that needs a little bit more of the having to concentrate.
Yeah, the finer detail, isn't it?
The finer detail.
Is there a constraint? So, I mean, if you're saying that for a lot of people are saying that after 2 or 3 days, and the sort of the benefits slightly wear off, could you have the treatment every 2 or 3 days? Is there anything stopping you having the treatment at all?
No, there isn't. But most people find that one session a week keeps them going for that week, even though, towards the tail end, they might feel that, they're ready for the next session. So no, absolutely. And what we recommend is also that once a year, everyone does another block of sessions. So to keep that going.
Yeah.
Sometimes the block sessions are really, are important, and that's what sort of builds up the levels of oxygen again.
So when you'd book it as a block of 10 or 20, would you, or something? Is that what you mean, or?
Yeah, so normally, initially, when you first go in, you would have, it depends on what protocol we're following, but generally for neurological conditions, the protocol is 15 sessions.
Right.
And in an ideal world, pre-COVID, I'm afraid, because at the moment, since COVID, we haven't been able to fit as many people in. The ideal was one session every day, Monday to Friday, for 3 weeks.
Oh, wow.
And we would work through an ascending protocol. So you start off at the lowest pressure, you have your assessment, you have 5 sessions at the lowest, you have another assessment, and then we see where you are. If you've had significant benefit, you would stay at the lower pressure, or we would recommend that you stayed at the lower pressure. If there hasn't been much, then we would suggest you try the next pressure up, and that's how it builds after 15 sessions. And most people by the 15th session feedback that there isn't a difference, and they want to carry on having a weekly session.
So basically, then they're going. So the block sessions are the intense one. Then they go on to a maintenance, and then you're saying, but once a year, go back to having that block.
Yes.
Sessions again.
And sometimes it's not as many as 15. It could be as few as 5. But it's important to have that maintenance.
And as I understand it, those block sessions are actually are you finding out what sort of level works best for you. If you in those sessions, are you building up? So do you have, when you start again, do you then start back at the bottom and then see where you?
No. So generally, we use the block sessions to, as you said, to find out what pressure suits the individual best, because everyone's different, and some people don't react well to higher pressures, and some actually don't react well to lower pressures. So they just feel, I don't know, that the session isn't as beneficial, or doesn't go as well, or their ears might, play up a little bit more. Or by the end of 15 sessions, most people know where their level is, and the new block sessions that you would do a year later would be at your pressure.
Right. Oh, okay. And you just have an intent thing. I know that when I went to the one I went to in Guildford, I met a lovely guy who has MS, and he was in a wheelchair. I'm not sure if he was in a wheelchair permanently, but he was for that sort of session. And he very kindly showed me that he's found that for his bowel and bladder, it just made such a difference. And I felt I wanted to say that because we do so much with people that have bowel and bladder issues, and a lot of that is, I suppose, because of your muscles. And as soon as any form of tiredness and fatigue sets in, your muscles are the first things to give up the ghost, really, aren't they? And I just thought that was, that's something that's so practical that really helps somebody.
You're so right, and I should have mentioned that as well in my, in the benefits, because that's the other side that most people highlight, that bladder and bowel control seems to improve. Things like the frequency and tends to get better. So it's one of the areas that does seem to improve. And if you think about it, oxygen is a natural anti-inflammatory. So where there are areas of inflammation in the body, and bladder and bowel tend to have flare-ups, especially through conditions like multiple sclerosis, that's when it comes into its own, really. So people do find a benefit, as you say.
And also the other benefit that I found out today that you have said to me also works is tinnitus.
Yeah, so we have a number of people who come to the centre for tinnitus. And for some, it really does make a difference. Again, I think it's very dependent on how long you've had the condition for. And so the earlier you get into check with anything, really, whether it's even in where there has been more research done, for example, in sports injuries, the oxygen or the pressure helps get that oxygen through areas where there's inflammation. But if the injury is very old and there's a lot of scarring, then it's more difficult, isn't it? Oxygen isn't going to get through because of the scarring. And so it's the same with any other condition. So the longer you've had that for, and there's scarring and areas of it, it's a bit tougher. But if you get to it quick enough, it can make a real difference. And the great thing about oxygen is that it's non-invasive. You're breathing like you normally would, and the effects or the side effects. So there is a list, and we make sure that everyone is aware of them. But I can tell you that in the 32 years that the centre, the Brightwell's been going, and across all the other 50 centres, there have been very few issues. And we've done, personally, over 30, however many years, I think we've done over 100,000 bums on seats of sessions. So across the centres, God knows how many, that equates to. And there have been no major incidences. Generally, what you feel is like when you're traveling in a plane, when you go up in a plane and you feel the pressure on your ears. So you end up having to clear them. So you do the Valsalva maneuver, pinching your nose and sort of blowing through your nose to try and clear your ears, or swallowing or moving your jaw. That's really important. They all help. But in the main, it's just uncomfort in the ears that some people feel. But that's easily dealt with.
And then the other thing that I know that you're going to start researching, because you've heard already, for people with long COVID, is that they think that there may be some real benefits here for people.
Absolutely. So we've already had a few people with long COVID come through the centre. In the case of one, they are having ongoing therapy because they have more than just long COVID. They have another underlying neurological condition. So that's been really helpful to them, and that's what they've fed back to us. In another case, we had a person with long COVID who had the 20 sessions and actually felt so much better that they are now on a break and are going to see whether those benefits persist. And if they do, then there's no reason for them to have any more oxygen. But if they come back at all, then their thought is to come back. I know that there are doctors out there currently looking at oxygen and hyperbaric oxygen and long COVID. And I know that some of the other managers who, we're all sort of looking out for what's there, what's around the corner, who's talking oxygen. So Julie from the Nottingham Centre is in contact with a a GP or a doctor who I think is doing some research who was on this morning. And so what we'd like to do as centres, I think, is, we have the people who come in and use the oxygen, is collate the information. But if all of us were collating the same information together, it would be so much more beneficial. And we're here for people with long COVID as well. So if anyone is out there and wants to find out about centres, it's really easy to do. The national website will give them a list of their closest centre or a couple of their closest centres, and all they have to do is get in contact.
Yeah, no, I think it would be great, and then maybe we can then get that on the NHS, and then you can get small funding to do, because obviously it's not.
That'd be great.
It's obviously not just the oxygen that you do. You do lots of other, because when you have a neurological condition, there's so many things that you need to have worked on in your body totally, don't you?
Yeah, absolutely. It is, it is about the bigger picture. It's about the bits of the puzzle. The more that you are able to do for yourself, and the more those bits that you can take and put in. So whether it's the oxygen, physio to keep you more mobile, and exercise, the food that you put in your body, so that you don't want things that are going to cause inflammation, and you want to make sure that you're drinking plenty of fluid so that it helps with things like your bladder and bowel. The more of those things that you do, and the centre is a centre that looks at the whole person. We're really keen on, because we're member led, we can do anything. If our members feedback and say, we'd really like to look at this, why don't you look at this for us? We can do that. Why not? So it is
by popular demand.
By popular demand, exactly.
Yeah.
And the more diverse our groups are, then the more different things we can look at as well. So I think there's a real place for MS therapy centres or therapy centres like ours. And it can only grow and grow, because there is so much less help available out there. For the NHS doesn't have pockets like it, deep pockets, and so people have to help themselves.
And were you closed during COVID? Were all your centres closed, or were you allowed to stay open?
It was a tricky one. So initially, I think the majority of centres closed. I don't think every single centre did, but the majority of us did. And then really the advice just wasn't there. So we did turn to government, to our local MPs, and tried to find a way through. But ultimately what we did was we united. We, on things like on Zoom calls, all the centres got together, or a lot of the centres, and we basically came up with a plan ourselves, and we put together policies and procedures, which we shared out amongst all the centres, whoever wanted them. And I think that just gave us the impetus to know we were doing things the right way, and opened up, because our members, the first thing we all did was a survey to find out, how is this affecting the people who use the centre? And what they fed back was that they were struggling.
Yeah.
Needed the oxygen, they needed the physio, and they needed the social side of things, even though that's been more difficult to deliver. And that's what we did. So we said, they're telling us they need us, we need to open the centres again. And so in June last year, June 2020, our centre reopened. And I think there were a couple of centres who opened before us, and then slowly all the other centres have opened up.
And you stayed open throughout because I suppose it's an essential service, but you've then got the problem also that the people that come to you are the most vulnerable.
Yeah. So, all the policies that most centres have put in place are so strict and stringent. We follow full PPE for therapists, social distancing, mask wearing. And in fact, because of the vulnerability of our members, we've carried on doing that beyond the 19th of July. And our members are really appreciative of that fact. We have opened certain things up. We've now opened the reception area so people can come in, sit down, take a mask off and have a coffee. But beyond that, we are really, really being strict on our procedures, because we want our members to stay safe, stay COVID-free, but have the benefit of the treatments that they have at the centre.
Totally. So, but I think that's actually, I mean, we've run some coffee mornings at Talk Health and asked people, and I think most people want that. They want to have some freedom, but they still want, we need to have the space, we need to have the general mask, we don't want to be with loads of people.
No, and you know, in our case, and it's the same probably for other centres, we're not teeming with staff. We don't have, you know, the capacity for, a lot of the people who work there are volunteers. I say work, they're amazing. But if we were to be hit by COVID, we'd probably have to end up closing the centre, you know, and then where would we be? So we have to be really careful in what we do to make sure we can stay open.
Let me just check on our little guidelines as to what we've said. So we've talked about oxygen therapy, how it works, what a chamber is, the benefits, definitely the benefits. The one benefit that we haven't discussed, which I'm obviously interested in, is the beauty benefit that I keep hearing about.
Do you know, it's so when I first got to the centre many years ago, I met all the people who were having oxygen at the time. And again, this is anecdotal, and it's, you know, but I do know that it is that I know that there are medics out there, and you know, in Harley Street, that have oxygen chambers and charge a huge amount of money for women or men to go in there for treatments. But the one thing that struck me, and I remember this, like, was how young everyone looked when they were telling me, oh, I'm 50 and I'm 60. And it was like, really? So there seems to be that, again, you're talking about cells taking in oxygen, you know, it sort of speaks for itself. There's it generates new cells as well and build up. I know that there was, studies done in that area as well. So it sort of makes sense, doesn't it?
And honestly, I think if you're going through what these your members have with all their conditions, and also people with long COVID, they deserve to go and have,
you know,
an oxygen facelift or whatever it might be, whatever you want to call it, don't they?
Absolutely. If anyone deserves it, if that's the perk, then no one deserves it more. You're so right. Yeah,
totally.
Absolutely.
Okay, and before we go on to questions, so how do you access the therapy? And so we've spoken about that, because I know we've got links on our website. It's very easy to go onto the MSNTC. They've got a lovely map. You just put your postcode in and you get a choice, basically, of the centres. And so it's pretty much covered over, it is England, Scotland, Wales, and are there some in Ireland as well?
There are some centres in Northern Ireland. So definitely have a look at the national website, because that's where you're going to find your nearest centre. And once you found that, then just pick up the phone and give the centre, or an email, give the centre a call. Not all centres are open to people to other conditions other than multiple sclerosis, but many are. So it's always worth just trying.
Yeah. Okay. And I think the last thing that we said we were talking about was long COVID and the benefits. And I think you said, or I can't remember if you said, or I've heard it before, that they found with long COVID, when you've had the treatment, that actually that's it. Then it does mean there's a lot of benefits from it, and it doesn't mean you have to carry on having it.
Yeah, that's what we're unclear about at the moment, and I think everyone is. I don't think anyone knows what the long-term benefits are going to be of the oxygen. What we've established with very few numbers, so as I say, in our centre it's 2 people, and I'm sure, but there are centres with 2 and 3 and 4 people around the country, is that it does seem to have an initial benefit, and now it's trying to establish how long that lasts for. So actually being involved in, if we can, in that research would be really beneficial.
Because I know there are some frightening statistics with long COVID, that you feel you're better and then you do another relapse. So maybe it could be for longer, but it would seem to make sense if you can boost your oxygen, which is what keeps us all alive, as much as possible. Then that makes sense, doesn't it?
It makes complete sense to me. But it is a case of trying and seeing how far that gets you. So if, wouldn't it be great if 20 sessions of oxygen were all that was needed? And I guess for different individuals, it will be different as well. There'll be those where that may very well be the case. And then there'll be others who maybe do have some sort of return of symptoms. And so it may be that they have to do more or have management. But we'll establish that, and then, at least there's something that is helping.
So, and what you're saying is that you are opening, well, definitely your centre, and probably most centres are welcoming people with long COVID to try and support and help them at this time.
Yeah, absolutely. I think that was, having all lived through this time. It's something that's really important to us, and as I've said, and I'm sure it's the same for across the centres, that all the income that is made from, because people would have to donate for the sessions, goes back into the charity,
which is
to provide more oxygen for more people, basically. Yeah. So it's a win-win.
Good. If you have a question, please now's the time to ask. And I do have one question for you. What can oxygen therapy do to accelerate the healing of broken bones?
Yeah, so there's been quite a bit of research done around broken bones and healing, and in the States, or mainly outside the UK. But I think it's true to say that in a fit and healthy individual, so someone who does sports for a living, a professional sports player, it can cut down healing time by 1/3.
Wow.
Which I guess in that world is a huge difference, or makes a lot of difference. Especially in terms of the financials of having to pay a professional footballer, for example, for 2 weeks, to get them back on the pitch earlier. So, and I think it works in the same way. It's more oxygen delivered to the area where there's damage and inflammation. So a break, there'll be a lot of inflammation in that area, which makes it anoxic. So oxygen doesn't really get to those areas as well. And what the pressure does is it pushes more of that oxygen in. And also there are higher concentrations of it in the hemoglobin, in the plasma. So more of that goes in, and it promotes healing.
So, when you have broken arm, broken leg, it's 6 weeks, isn't it? Always 6 weeks. Maybe then could be 4 weeks now.
Could be 4 weeks, yeah. And we have had lots of experience with broken bones, actually. And in fact, a very recent experience, our senior operator, I'm sure he won't mind me saying, and he feels that he came into it quite late because it was to do with being able to access the therapy. And that is one of the main issues I think lots of people do have is, if you do have a broken bone, you tend to it tends to affect whether you can drive or not, if it's a broken arm or your foot or something. So getting to a chamber may be the difficulty, which was in this particular case. But we managed to sort something out, and so he's been coming for the last 2 weeks, and the difference has been, he says, it's made a huge difference already. So,
wow. And is he looking younger as well?
He is, he is one of the youngest people at heart that I know in the whole centre. I'm sure he wouldn't want me to tell you his age, but yeah, he's lovely.
Right, well, I think that probably draws our session to the end. So, Doro, all I can say is thank you so much. And I just think the work that you and all the other centres offer is just amazing. And I suppose it's difficult, isn't it? You want to push the centre in order to encourage people to go, but then you suddenly think, oh my God, do you then run out of resources? It's a vicious circle, isn't it?
It is a vicious circle, and it is about, it is hand to mouth for a lot of centres through a lot of the time, because we all have to fundraise our own money. Very few centres, I think, have any sort of statutory support whatsoever. The members contribute for treatments in our case, not in all cases, and that really is helpful. And then we put on events and mainly events, and we write to trusts and things like that for the rest. But it's been really difficult over the last 2 years because we haven't been able to do any of that.
No.
So yeah, it's a upward journey, but that's what we do. You know, it's the service that we are able to provide does make a big difference to so many people, and we wouldn't do it any other way.
And I think what's unique about you is the fact is that you give that, you know, lots of people join charities because there's something that, you know, there's the advice, but you actually do something that's very physical and tangible. And that's what kind of appeals to me in many ways, of how practically you help people on so many different levels.
Absolutely. You know, research is so important. We know that, you know, to get to the bottom of why a condition, you know, and eventually, ultimately, to find a cure. So that aspect is really important. But actually, especially with long-term neurological conditions, where, I mean, it's in the title, long-term, chronic, you know, it affects every aspect of people's lives and their families as well, you know, with people having to give up work to look after their loved ones, income goes down, you know, you're struggling, you're having to buy bits of kit and equipment that are so expensive. So anything that we can do to support people to maintain their mobility, to maintain their mental well-being, their physical well-being, and also just to keep them as happy as possible, you know, to actually hear someone having fun and laughing and making friends and having that social side just is all worthwhile. And that's what centres are there for.
Brilliant. Well, thank you so much for your time, and hopefully we might speak again soon.
I hope so, Katrina. Thank you very much.
Thank you. Bye-bye, everyone. Thank you.